Beccy Cooper.
Thank you, Chair.
Thank you, Dr. Dash. And as you have just said, you have got an interest in lots of different parts of healthcare systems. And I just wanted to focus your attention on your chair role in North West London and your interaction with NHS England. And if you could just reflect for us a little bit about how you see the culture of NHS England from that role, that would be really helpful.
Yeah. I mean, we've had very positive relationships, but I'm aware through conversations with some others that the dynamics are different in different places. So that's something I'm quite interested in. So,
Dr. Dash, when you say positive, what is it that you're sort of experiencing from NHS England that leads you to believe that is a positive culture for you?
So NHS England, both the regions and national. So in terms of the region, we have a good level of interaction. So I get support. That's a crucial thing. Always both in the regional directors I've worked with, a lot of support. I can pick up the phone and say, well, we're stuck with this, or, could you help with that, or what do you think about this, and so on. So we've had a lot of support, and that's been really helpful. We've had some good conversations about what are things that we think we could do jointly together, and how do we get that balance right between what we do at the ICB level versus what we do at the regional level. Those have been good conversations. I wouldn't say necessarily always agreed on them, but they've been good balanced conversations.
Okay, so sorry, I'm going to just because I'm going to try and move on. So that sounds all positive, and that's great. So if I look back to what you said earlier on to one of my colleagues. One of the things that you are interested in is around decentralisation and having less of a focus at the centre. So I understand it's great you've had a positive relationship with NHS England, but as the incoming chair, you will be, if you're successful in this appointment, you will sort of help to set the culture of NHS England.
Absolutely.
Do you foresee the devolution, possible decentralisation of NHS England as a positive move for that culture? Or are there issues that you can foresee coming forward?
Yeah, okay. So largely positive, because there are a whole set of things that do come from NHS England. So I've given you the positive, but some of the things which more come from national rather than the regional, I don't think should be coming. And, others have spoken about that. Patricia Hewitt went into quite a lot of detail about that in her review that she did. But
so you generally agree with the Hewitt review as to what came out of it?
Okay. Yeah. So I definitely think there's more latitude for people to decide locally. I mean, there is quite a lot of telling that I'm not sure is necessarily the most constructive. So that I'm definitely supportive of that. At the same time, which I alluded to earlier, I do think that there are things which could be better done once. So I think of, for example, the old principles of healthcare value. How do we really understand what's the potential impact, what's the return on investment of different healthcare interventions, where should we be putting our money, what could an optimal cost structure look like, and so on and so forth. It does not make sense to do that 42 times, and we definitely do not have the skills and capabilities to do that 42 times. So I think there's quite a lot of things that could be done. I mean, I think in the whole public health field, there's quite a lot of things which actually as a country we've done really well by doing nationally and so on. So I think getting that, the evidence base, the understanding, the analysis, doing that once. But then how do you deliver that? How do you develop the priorities? How do you decide what you're going to do in these particular streets or in this particular neighbourhood and so on? You can't do that nationally. That absolutely needs to be done locally. So
it sounds to me as though you're saying that currently you don't think the balance is that there's too much centralisation currently, and that you would be supportive of seeing a more decentralised NHS and therefore a more streamlined approach to NHS England as a sort of central function.
So many people, not necessarily me, there are many people who are saying they would, including NHS England, saying they would like to see more things decided locally. I have actually, I've had a go at starting to lay out some of the things. It's quite interesting when you get into the detail.
And that's fine. If you're successful in this appointment, then you will be the chair, and you will be, part of your role will be to drive forward sort of the cultural change, and you would be supportive of that.
Yeah, I think we absolutely need to say these are the things that could and should be done locally. and these are the things that could and should be done nationally, and I think we should have a sensible conversation and debate about that.
Okay,
based
great.
on the principles of subsidiarity.
Okay, yeah. And one final one from me, just sort of listening to you, and as going back to, obviously you've done a lot of things, you've got a lot of interests, and as the chair sort of rightly pointed out, there are different types of chair in terms of interventionist. How comfortable do you feel about moving from that sort of more operational sort of approach? I know you're an ICB chair, but I've seen what you've done. You have sort of been pretty hands-on, moving to a more strategic role where you are sort of looking at that bigger picture. So I guess my final question would be, if you are successful in this appointment, in 10 years' time, what would you say that your input would have been that I would be able to say, okay, Dr. Dash was the Chair of NHS England, and in 10 years' time that strategic vision has come through. How would you want me to be able to see that?
Okay, I think you're asking two different questions.
I am asking two questions,
yes.
You're right, yeah.
So I think in terms of the strategic vision, if we could deliver those 3 shifts, hallelujah.
Okay.
So, that's, I think, reasonable. But we've got to then be clear on what does that actually mean. So I do think that over 10 years, it's not just about going 3 shifts, we've done it. That then has to translate through into better health outcomes, better life expectancy, better quality of life, better access, and so on and so forth. So there's quite a lot in that.
And sorry, just to be clear, so your contribution towards that 10-year vision
is then your second question, which is what would my role be as the chair as part of that. So first off, again, I work within the framework that is set to me by the government of the day, so to be clear on that. And then I absolutely think it comes back to me working hand in glove with the chief exec, with the exec team, with the whole of the workforce, and we haven't actually spoken that much about the 1.5 million people, with the whole of the workforce to actually deliver these changes. And I absolutely recognise, I think that the specific role of the chair, which is, again, I'll come back to, so there's a support function, there's a challenge function, there's bringing clarity, there's being a good communicator, there's being a conduit, so listening to people, picking up what different people are saying, and so on and so forth. It is absolutely not being operational. So
Okay.
I think it's more, how do you get that balance right?
Okay, thank you.